Question number 5 is a healthcare question. We had, I think this was by far the most asked question from the group, was about healthcare reform. So the question is, the Colorado Democratic Party platform supports a single-payer system of healthcare as a national and a state solution. Do you support Colorado adopting a single-payer system of healthcare? If so, why? And if not, what type of reform, if any, do you believe is necessary to provide affordable access to healthcare for the 800+ uninsured Coloradans?
I was working on the health reform issue. And I know that this is a critical issue, especially with a lot of people from different countries coming in, and we have issues that they're not covered under health plans. I feel that Colorado health plan program at this point is only institutionalized for Colorado that they're working on. And there's one going on in Washington, there's one going on in Portland, in different states, which gives me a lot of questions, because I wonder if I travel to Florida, or if I travel to New Mexico, if I'm covered, because it's only institutionalized right here in Colorado. My reform to this is that there be a national card that is sent out to everyone. And that way we're not eliminating doctors and physicians that are already, that would be outsourced, and that everyone would have a card and they could keep their provider that's already with their doctors, Kaiser or whatever, and then we would be able to tap in to the funds that's allocated for the healthcare system. So that, I feel, would be fair. That's all I have to say.
It's going to take political will to actually get something accomplished on healthcare in the state of Colorado. Until the policymakers have the will to come to the table with the cost drivers and look them in the face. That's the insurance companies, the hospitals, the providers, and the pharmaceutical companies, and say, we are going to make some changes in healthcare in the state of Colorado. Until that happens, we are not going to make significant strides. We have worked on a lot of issues in the state of Colorado. We have actually implemented some of the Obama administration recommendations, such as transparency, such as trying to reduce administrative costs. What we have to do in Colorado is to get more people covered. It is absolutely unacceptable that we have 800,000 people that are not insured, and we also have a very significant number of people that are underinsured. It's a tough discussion. And how does it get paid for? You can talk about universal health care, you can talk about single payer, and we certainly can talk about cost. That probably would be one of the most effective ways. In order to get more people covered, we are going to have to talk about subsidy. Subsidy is a very big and tough issue in the constraints that we live under with Colorado's budget. But until we do that, and until we find ways to say to the cost drivers, we're going to reduce costs, we're going to cover more people, it's not going to happen in the state of Colorado. I do commend those individuals in our current session who have looked at some issues and have managed to get some legislation passed this year, but it is not the legislation that is needed in order to have total and full coverage for those 800,000 uninsured. We have working people in the state of Colorado, as well as working people in the state government that can't afford insurance policies. We've got to do something. We've got to come to the table, get the cost drivers to the table.
I think the single-payer healthcare system actually has a lot of merits. What I like about it is that I think it's ridiculous that your health insurance should be tied to employment. People who are unemployed often need health insurance most, right? And so I think that's one of the benefits of having something like single payer. I think there's also a tremendous amount of overhead or administrative expense associated with our current healthcare system. And so the single payer really looks at ways to bolster efficiencies through this pooled system. Now, I don't think that's the only solution. I think we have to do a number of other things to broaden this safety net for healthcare. First, I was terribly disappointed that Representative Cafalis' bill fell on its ear that would have progressed single payer in terms of examining it with this board of 23. I think we should absolutely examine that critically in the legislature. But I'd also like to see other initiatives undertaken. For example, I would like to see our community clinics fully funded. And how do you pay for it? How do you get it done? I was very impressed that the legislature recently passed this bill for the hospital assessment fee, right? We keep throwing around this number of 800,000 Coloradans who are currently going without health insurance. Well, this hospital assessment fee has gotten every hospital in Colorado on board. We're basically assessing a fee that's permissible at the federal maximum, okay? This money comes into a pool, and we're able to pull down Medicaid dollars, about $1.2 billion in Medicaid, to match. And now we're going to ensure it's estimated another 100,000 Coloradans, right? So I think we need to continue to look at public-private partnerships, create a fee and other structures to try to bolster our health safety net and fully fund our community clinics. Thank you.
So this is an issue where our Senate district is hit disproportionately hard. So a lot of people know the 800,000 number. What people don't know is that right now 42% of all African Americans in the state of Colorado don't have health insurance. 57% of all Latinos in the state of Colorado don't have health insurance. 62% of people making $35,000 or under don't have health insurance. Those are populations that are significantly hit in our district. And so that this problem has to be significantly led by us because the burden is significantly borne by us right now. And there are false arguments out there. We know that we have to get to universal health care. And folks will say, well, we can't afford universal health care. The reality is, folks, we're paying for it right now. One hospital, this year alone, paid $200 million in unreimbursed health care costs. $200 million, one hospital, one city. So we're going to pay for health care either way. Either we're going to force everybody to use the ER as their only form of medical treatment so they can't get preventative care, or we're going to actually be thoughtful about making sure that people have health care on the front end so they can get preventative care and drive down the costs of catastrophic treatment later. So I think there's no doubt we have to get there, and there's no doubt we can get significant savings by widening the risk pool so we get more people involved in insurance that are paying into the pool. And we know that there are ways to do that well publicly. The Medicare system right now has a 3% overhead cost. Private systems have 25% because they're investing massive amounts of money in service denial. They're investing massive amounts of money to make sure people don't get covered. That's not a wise use of resources. So if we want to invest in resources that matter, we want to invest dollars in places that actually deliver health care to kids and parents that need them, as opposed to investing dollars in denying people from health care they need. One last thing is I'll say, so I also would like to see us continue the conversation about what is the best way to get to universal coverage, and what are the opportunities we have in this state to work together with the Obama team as they begin to roll out a federal plan this year, to look at some federal matching grants that make it possible for us to be on the leading edge of getting universal coverage through a single payer system or through a hybrid system like the one in Massachusetts. So I think there are huge opportunities for this right now, but someone from this seat has to lead it, because right now we're taking the hit more than anybody else.